So now taking us back to our clinical applications of our superficial heating modalities. Again, here you have your direct clinical indications. So the clinical indications for superficial heat are to decrease pain, decrease stiffness and soreness, and help to decrease muscle spasm. Again, the thing to remember is that you're only going to get your significant temperature increases to approximately 1 centimeter. So if you're looking to get a lot of those physiologic effects that we talked about, you're really only going to get them to a significant level in very superficial structures, based on some of the examples I gave previously. Your contraindications, so the general heat contraindications that we look at are impaired sensation and circulation. Again, part of that is just because of if sensation's impaired, if the heating modality is starting to burn the patient, they won't be aware of it. If circulation is impaired, they won't be able to dissipate the heat, which could create a burn. And acute injury. Now, again, the question here becomes that since most of the effects are superficial, the question becomes: are you really going to do any more damage? Or are you going to really aggravate the injury if you did apply superficial heat? For the purposes of the lack of benefit to acute injury, we will leave that as a contraindication for all forms of superficial heat. Be aware of some of the special contraindications. So as we kind of go through, and it's important to kind of look at this for lab purposes, if we look at some of the other forms of superficial heat, some of them have some of their own specific contraindications based upon the mechanism by which they deliver their heat form. And just some precautions to take into consideration. Typically, most of these won't be an issue in most circumstances, but they are things to kind of be aware of. Note the rate of temperature change. So if there's obviously a big difference between a specific modality and the body part, there will be a pretty rapid change in temperature, and again, the risk for maybe causing a burn or something like that, again, typically won't be an issue, but just be aware of that. Any metal in the area, pretty much all the superficial heating modalities, you're rarely ever going to heat up any types of plates or pins. Again, just something to kind of note. Dressings, tape, and clothing, particularly anything synthetic. So, certain types of clothing, if it's not made out of cotton, may actually heat up. Same thing with like wound dressings. If they have adhesive, or depending upon what they make the dressing out of, they can possibly heat up and again irritate the patient's skin. We talked about in lab, you don't look to lay the patient on the modality, lay the modality on the patient. So this mostly applies to moist hot packs. Again, ideally, don't put the patient's body part on the hot pack, because of the fact that you will typically get a much more rapid increase in temperature, and again, there's the risk there for burns. And just be aware of the patient's age. So particularly older patients, again, even if they don't have any major circulation problems, typically as people age, their circulation in general isn't as good, so you just need to be aware of that. In your timing, and just think about the body part, and you may even want to consider possibly laying an extra layer. For instance, with a hot pack, you may want to put an extra layer down just to make sure that for an older patient that they don't get a burn. Okay, so our different forms of superficial heat. What we're going to be looking at here and discussing basically your hot whirlpool, your moist hot packs, the paraffin bath, and we'll talk about some of the what goes on with the paraffin bath, the infrared lamp, which we don't really use a whole lot. We'll make mention of it, but most places do not use infrared lamps anymore. Again, some of the science concepts that we discussed, for instance, like the inverse square law and the cosine law will apply to infrared lamps, but they don't get used as much. And Flute O therapy, we'll talk about that and discuss what that is, because most of you probably have not seen a Flute O therapy unit. The reason why moist heat gets used a lot, so you see different types of hot packs. You have, like, for instance, the electrical hot packs, which provide more of a dry heat. But typically with moist heat, it's much more comfortable, and you may get a slightly increased depth of penetration with moist heat. So that's why we look to apply moist forms of heat to the body, just to kind of help with the comfort and maybe get a little increased tissue penetration. So for your warm whirlpools, when we look at the temperature of what we want the whirlpools to be, you never want to exceed 115 degrees. Once you exceed 115 degrees, you increase your risk for burns. And we had talked about the whole concept of the heat sinks and how you kind of want to change your temperature based upon how much of the body is going to be submerged in the whirlpool. A full body warm whirlpool, so these are the numbers we're going to use for class purposes. A full body warm whirlpool should be between 100 and 105 degrees. If you are heating an extremity, 105 to 110. So again, the extremity could be a little bit warmer because obviously, again, the body can dissipate the heat in a much easier fashion versus when the entire body is submerged. It's harder. The body's temperature will increase a little more rapidly because of the fact that there's not going to be as much of the skin surface area exposed outside of the actual whirlpool. So note those temperatures for the different body part areas. And again, from the standpoint of safety with a whirlpool, so you see the different parts of a whirlpool here. You can adjust how the air comes out to cause the turbulence, if you will. You can change the pressure coming out of it off of the turbine, so that's something to note. You need to make sure that the whirlpools are plugged into a ground fault interrupter in case there is a power surge, to make it that nothing happens to the patient in the event of a power surge. Even though they are plugged into a ground fault interrupter, you have to make sure that your procedure for putting the patient in the whirlpool kind of follows a pattern. So what you want to do is you want to turn the whirlpool on before the individual goes in the whirlpool, and you want to make sure that the patient comes out of the whirlpool before you turn it off. So turn the whirlpool on, patient goes in the whirlpool, patient comes out of the whirlpool, you turn it off. And again, even though it's plugged into a ground fault interrupter, you still want to do that just in case something were to malfunction. It just decreases the chances of a power surge and possible electrocution to your patient. The Flute O therapy unit, as you see in the picture here, an individual getting treated for their upper limbs in the Flute O therapy unit. What basically a Flute O therapy unit does is it uses forced hot air, and it actually kind of blows around a dust which is basically made up of ground up corn cobs, interestingly enough. So it basically kind of feels like more or less like sand kind of blowing around. It's a form of convection heat transfer, and as your book talks about, it's kind of compared to, they call it like basically a dry whirlpool. So it's essentially this warm air blowing these ground up corn cobs around, so you do get heat and a slight massaging effect that does go on. You can use it for both the upper and lower extremities. Obviously, kind of limit it with how much you can get in there. You see the tops of this unit. What people actually use those for is if they actually wanted to treat the ankle and foot, you can stick the ankle and foot into the top of the unit and get, again, similar effects to what you would get with a warm whirlpool. The heat for this, the temperature ranges for this usually ranges between around 100 degrees up to about 120. So you can get a little warmer with this than with an actual whirlpool. So because of the difference as far as how what's actually producing the heat. So a little bit of a different application as far as from a timing perspective. You would do a treatment about as long as you would do with a warm whirlpool. One thing that I did want to note before I get into the moist hot pack is that with the Flute O therapy unit, you want to make sure that all wounds are dressed prior to going into the Flute O therapy unit. So you don't want any open wounds just being exposed to the dust particles kind of blowing around. It'd probably be just recommended that if someone had an open wound that they don't even utilize the Flute O therapy. In as far as what is common, probably the most common form of superficial heat applied are your moist hot packs. So the moist hot packs are kept at a temperature, so hydroculators typically range between 160 and 180 degrees Fahrenheit. Again, you want to make sure that you have at least one layer of toweling, ideally between the hot pack and the skin. So you want to make sure you do that. The picture, what's the picture is depicting here, some hot packs come with different colored tabs. So the idea here is that if you're doing your moist hot pack treatments over the course of the day, you kind of have your own code as to how long. It's just to let you know how long the hot packs have been in the water, because what you don't want to do is use a moist hot pack on somebody, put it back in, and then have another athletic trainer take the same hot pack out only like 5 minutes later and use it on somebody, because it's not going to be very warm. So you can kind of communicate that in your clinic or athletic training room, kind of what what your procedure is for noting which hot packs have been in the warm water a little bit longer. Another heating modality for superficial purposes is the paraffin bath. Now, an interesting thing about the paraffin bath, so if you've never done this before, it's basically just like a hot wax that you utilize around the body part. So what you do is you essentially dip the body part region in multiple times to create a layer of warm wax. And what's typically recommended, or at least what I've done in the past with paraffin baths, is once you get the paraffin wax on the person, I would, in addition to that, wrap a moist hot pack around the body part as well, just to create even more heat for the body part region. An interesting thing to note is that the paraffin wax is actually kept at a higher temperature. So it's kept at a temperature at about 126 degrees. Now, if you put a limb in water that was 126 degrees, you'd actually get a burn. Actually, you probably wouldn't even be able to get the limb in because the water would feel so hot. The reason why you could do it with the wax is because of the components of the wax and the oils, the mineral oil that's in the wax. It creates a lower specific heat, so meaning that the wax would have to be heated to over 130 degrees to produce a burn. So again, it's typically kept at about 126 to keep it melted, and it won't cause burns to the skin as would water at that temperature. As far as with the paraffin bath, typically the body part area you're going to treat with it most often is the hand, which again, because the joints and all the structures are pretty superficial, you will get a significant heating effect with that. You could, if you wanted to, I've never done this and I don't suggest it. Technically, you could probably treat the foot as well. For sanitary purposes, you may or may not look to do that. One thing to note is that I talked about to note some of the specific contraindications with some of these other heating modalities. Paraffin bath, you will not be doing any type of open wounds or even any early scars. So you want to make sure that you inspect the hand or body part area that you're going to be sticking in the paraffin bath for any wounds or fresh scars. And you want to make sure that you don't go any longer than 6 months before cleaning the paraffin bath. So again, because of the heat and everything, you would have the chance for bacteria and things like that to form. So just make sure that you don't go any longer than 6 months before cleaning. And again, no open wounds or fresh scars into the paraffin bath. Another thing you can utilize are electrical heating pads. They are, from an economical standpoint, pretty good because they're relatively inexpensive compared to moist hot packs. Plus, you have to always replace the moist hot packs because eventually they do break down, and if the chemical in them leaks, you have to get new ones. They heat through a similar mechanism. Again, usually just what you look at is moist heat is typically more comfortable for a patient, whereas the electrical heating pads tend to at least not have the same amount of comfort. But if you do warm them up before you apply, basically you do get the same heating effect. Again, just not maybe to the same comfort level that you get with the moist hot packs. Again, but as far as like how long you apply it for and everything else, as we had discussed in lab, 20 minutes for all of your superficial heating applications, it would pretty much be the same idea. A form of portable heat that can be utilized, and they're pretty effective, are, for instance, the Thermacare hot packs that you can buy and where you could buy these at most drugstores. And essentially what they are is they're made up of iron, charcoal, and salt, and they're in like a little paper wrap conformed to all different body parts. And basically when they get exposed to air, a reaction occurs and it produces a very low level of heat. The idea is that you can wear them for prolonged periods of time, and they are pretty effective at increasing temperature. Again, it's a superficial effect, but it can produce, again, that general relaxation effect over a prolonged period of time. So they're good to wear over the course of a day for maybe somebody that has like some chronic aching pain. I've actually personally used these. I had once a basketball player who was recovering from some low back issues. He would actually wear one of these during contests, and they were beneficial for that. He would actually wear the version for the low back, and again, it produces a very low level of heat. But the idea is you can wear it over a prolonged period of time, and do get a slight temperature increase at a superficial level. But it allows for that relaxation effect and that decrease of that general soreness. So it's worth mentioning, just for the sake of conversation for now, these are modalities we will talk about. We're going to talk about ultrasound after we discuss cold, and we'll talk about diathermy after the next test. But the deeper forms of heat, where you actually get a significant temperature increase at deep tissues to promote a therapeutic effect, and we talked about some of the science behind these in this chapter, even though it wasn't necessarily the clinical focus. The two primary versions are ultrasound and diathermy, meaning that you can get significant temperature increases deeper in the body. When we talk particularly about diathermy radiation, is different characteristics of the infrared, and primarily because of, you look at the conversion mechanism for heating effect, and it also evokes different physiological effects. There are cellular effects very similar with ultrasound that you would get with diathermy that produces other healing effects and possible reductions in pain and muscle spasm. So this is the case study. I'm going to have you complete a short case study for class. Again, this is going to be due as per if you look on the announcement on Blackboard. So you have a 20-year-old female basketball player with low back pain that started about a month ago. And as you see here, these are some of the characteristics of what she has going on. So she has no radicular symptoms, so her pain is all on her back. Pain level 3 out of 10 at rest. She describes it as dull and stiff. Your evaluation reveals muscle spasm, and you're essentially looking at a mechanical strain injury here. So these are the questions I'd like you to answer. Again, be specific about what it is you're looking to do. So, I mean, again, I'm going to give points on this, and the more specific you are, the more points you'll get on the actual assignment. and we'll discuss these concepts in class the next time we meet. So take a look at these questions and make sure you answer all of them for the case study. And these just kind of summarize the learning outcomes. So look at your heat principles. Again, we did get into the principles behind what impacts some of the other forms of heat, particularly the deeper forms of heat via the conversion mechanisms, even though we didn't discuss the clinical applications of them. The focus here was on the clinical applications of the superficial heat. So again, know your effects, indications, contraindications. Make sure that you review the different contraindications for some of the other forms of heat. For instance, the paraffin bath, we talked about open wounds being a contraindication there for the application of paraffin bath. So make sure that you review those.